Hi, I'm Danielle, doula and perinatal mentor in the Mid-Ohio Valley. Should I get an induction? So I want to talk a little bit about not the medical specifics, because really induction, if it's medically necessary because your baby's stressed out or something like that, the medicine that is used for induction actually increases all of that stress on your baby. So that's something you can think about. The other thing to think about is your induction scheduled for 4 or 5 days in advance? And if it's an emergency, why is it not happening right now? And if something needs to happen right now, why would we add the stress of an induced labor to the baby or to the mom instead of doing an emergency cesarean? Those are some questions initially about the medical side. The other thing I want you to think about, maybe you're just thinking, I'm done, I'd like to have my baby, I'd like to schedule this around when my provider is going to be available. If that's something that you're thinking about, I want you to think about what induction actually does. So, of course, you have the side effects of an induced birth, like fetal distress, maternal distress. Death is always a complication of these kinds of medications. Yes, it doesn't happen very often, but you do have a lot of morbidity issues, specifically with the mom, because of how much stress it puts through the labor, and this is why. So you have a baby in your belly that has to move through your pelvis, okay? And you can see how there are different places in your pelvis that are shaped kind of in a different way. If you kind of look at this from the side, let's see where we can find a good angle. It's kind of hard to visualize that. So that's going to look a little, this is the outlet. If mom was on her back, this is what it would look like. If mom is up on her knees, this is what it's going to look like. Obviously, more room for the sacrum to move out as the baby needs to, because most babies' heads fit very, very well inside the pelvis. But moving past it, the baby fits well like this because your baby it's oblong. Most babies' heads are oblong. And if they're tucked nice and tight, that's going to be that smallest part of the baby's head. If they are not tucked, they have a wider part that has to go in. So a baby that's up really high specifically is probably not fitting down in that pelvis very well because of alignment issues. Very, very rarely it's going to be because a baby is so large that it's difficult for the mom to relax and allow the pelvis to flex. But normally it's because we're in a rush, mom's stressed out, she's got stress, tension, tightness from her body, her movements, and then the baby has to go through all of these different angles with this head. So you need time for the baby's head to mold in order to move those parts of their head to fit through the pelvis. If you add an induction on there, the only thing that induction is going to do is push harder. The baby has to rotate because, remember, the baby's head it's not perfectly round. It's kind of like front to back. So if they start out labor where your pelvis might be shaped differently than my pelvis, and my pelvis is shaped differently than somebody else's, and it's not going to be those standard 4 shapes of a pelvis. It's going to be your life added on to however you were, made. And then this particular baby is made a certain way, and they have to move through this pelvis their own way. So if maybe your baby's head is positioned this way, okay, against a pelvis that's shaped like this, we just start jamming their baby down with hard Pitocin contractions, and often the mom is in bed because she's in pain, and then she gets an epidural, and then she can't move. It's going to be really hard for you to move your pelvis. Like maybe you're lifting your leg up to get a big lunge to help that baby fit through the pelvis, but you can't do that anymore because you're in so much pain and you're scared, or you have an epidural, whatever it might be, or just not enough time to make this happen. Like it doesn't just go like, oh, baby's out. Okay, maybe every once in a while that happens, but normally it's like little bits of movement at a time, and those slower contractions that build up don't stress the baby out as bad. So if you're just jamming this baby down onto the pelvis, or maybe jamming it, if you remember, if you have your uterus that's like hanging way out far because it's stretching all these ligaments, you've got a lot of pain, and maybe you sit a lot, you crouch down a lot, you don't move a lot, whatever it might be, then you have a baby that's on your pubic bone and you're just jamming their head on there and it's not even going in the pelvis. So should you get induced? I don't know. I cannot answer that question for you. But what I can do is provide you with information that lets you think about what that actually means. So, should you get induced, or are there other things that can support spontaneous labor, moving through labor and the end of your pregnancy in a more healthy, wholesome, happy way? So if you're interested in learning about your specific situation and maybe things that you can do, send me an email or give me a call and we'll set up some mentoring sessions to help get your baby in a good position and help you relax for this end of pregnancy time.